Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon. Thank you for joining us. Before we get at our program, I just want to take a minute to say for years, today has been the next thing to a state holiday. Today would have been Carb Day. You're in black and white there, I see, thematically correct. But let me just say that this has always been a very, obviously, special American weekend, Memorial Day weekend, where we pay tribute to those women and men who put the uniform on. And I always have found a lot of symbolism in our state song back home again in Indiana on this weekend when many of our heroes didn't, in fact, make it back to see the moonlight on the Wabash or gaze through those sycamores. And so I would just ask that everyone keep that front and center. We're always reminded of that in a couple ways, because we also this weekend happen to be proud and boast about hosting the biggest single-day sporting event in the world year after year after year. I like to tell my gubernatorial cohorts that fact every time I get together with them. But we honor our men and women in uniform there as well over this weekend. And while we won't have a race this weekend, we will hopefully in August, and we'll maybe have one in July as well, planning on it. But you will have an opportunity to see a special program that will pay tribute this Sunday on on NBC from 2 to 6 p.m. And it's really don't miss television, where we'll not just honor those folks who didn't come back, who gave of their, as Lincoln said, their last full measure of devotion, but it'll also honor our frontline Hoosier healthcare heroes in the fight that we're in right now. So I just ask you to maybe circle that on your calendar, 2 to 6 p.m. NBC this Sunday, when we would otherwise have been doing maybe some other things that we would have preferred. And having said that, before I turn it over to Dr. Box, this is a long weekend. It's a weekend we've been looking forward to for multiple reasons. I would just ask of you to, for sure, go outside and take in fresh air. Breathe in and breathe out. Recharge, but do it responsibly. Do it safely. If you're around other folks, put on your mask. Keep that physical distance, that 6 feet plus physical distance, and you can have the weekend that you've been looking forward to, as I have as well. We all know the drill, and to learn just how important that is as we're entering stage 3 just today, And over this weekend, Dr. Box will give us the latest.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 493 additional cases of COVID-19 in our state, which brings to the total 30,409 Hoosiers who are known to have COVID-19. We unfortunately also saw 27 additional deaths in our state. To date, 1,791 Hoosiers have died of COVID-19, and another 150 are believed to have died from this disease based on their clinical diagnosis. We have also seen the number of Hoosiers tested for COVID-19 top 208. This is the result of incredible work and partnerships. Our ISDH team has done an amazing job with drive-through testing and has now tested more than 10,000 Hoosiers around the state. CVS has now started offering testing at 21 of its stores across the state, which will also increase our numbers. And our statewide testing effort has now tested almost 19,000 Hoosiers, with more to come. We continue to maintain our ICU bed and ventilator capacity with nearly 38% of ICU beds and more than 81% of ventilators currently available. About 16% of our ICU beds are occupied with COVID patients, and less than 6% of our ventilators are being used by COVID patients. As most of the state enters Stage 3 of the Back on Track plan, we continue to focus heavily on the 4 guiding principles that the governor has said will determine when and how we reopen our state. One of those key elements is the number of people who are hospitalized for COVID-19. We have the latest data from the Reconstruct that gives us a better picture of where we are in terms of hospitalization and recovery from COVID-19. So far, they've looked at over 29,363 individual patients who tested positive for COVID-19 since March 1st. Of those individuals, 7,839, or 27%, visited our emergency rooms. That's the same percentage as a week ago. 18% have been hospitalized, which is down slightly from last week. And 1,166 people have been admitted to the ICU. That's 4% of the overall positive patients and 22% of those individuals who were hospitalized and had to be in the ICU at some point during their stay. An important part of hospitalization data is also the discharge data, which helps show our recovery rates. 72% of our hospitalized patients have been discharged. 10% are still likely hospitalized, and sadly, 18% of our hospitalized patients have been known to die. I want to emphasize is that every recovery journey is different. Remember that if we had 72% of those hospitalized patients discharged and only those percentage that were admitted to the hospital, everyone else, so almost 82%, were either not hospitalized or had very mild disease and were unaware of it. COVID recovery can be quick when the illness is mild, or it can be a lengthy process, especially for those individuals who are hospitalized for a long time or placed on ventilators. So we want to keep people out of the hospital and to protect them from COVID so that these numbers continue to trend in the right direction. As the governor's latest executive order states, Hoosiers should still limit their trips out and about. I know that's hard, especially when children who have been cooped up and are finishing up the school year want to get out. This is normally the time of year where people are hitting the road on vacation, going to the zoo, going to the Children's Museum. But I want to remind everyone that this is not a normal year. We have to remain vigilant and continue to make informed decisions about where to go and what we do. That's the best way to ensure that these numbers continue to trend downward and protect our most vulnerable Hoosiers. So enjoy the holiday weekend, even if it looks different from last year. You can still have your cookout with close family members. If the pool's open and it's really crowded, possibly it's better to wait till a different day to go. But above all, be safe.
Thank you, Dr. Box. Next, we'll hear from Steve Cox, the Director of Homeland Security. Steve, you want to talk about our collaboration out and about the state in terms of education and enforcement?
Yes, sir. Thank you, Governor. Hello, I'm Steve Cox, the Executive Director of the Indiana Department of Homeland Security. I want to start by reiterating some of the safety advice that you've heard from Dr. Box, Dr. Weaver, and others. As we move to Stage 3 for the Back on Track Indiana plan, now is not the time for us to become complacent. As the state continues to reopen, we need to remember this increased flexibility also brings additional challenges to our commitment to continue social distancing from one another. I believe Dr. Weaver stated a couple of weeks ago that the hard part starts now. Stay diligent to protect yourself and your fellow Hoosiers. So please follow the CDC guidelines so Indiana can continue to move forward safely. If you're 65 years of age or older or have high risk factors, you should continue to isolate yourself if possible. If you have a loved one who is 65 years old or older, who has serious underlying medical conditions, you should continue to utilize social distancing guidelines. While you may not be in a high-risk group, you can infect someone in the high-risk group. So Hoosiers, help protect your loved ones. Please use a mask when in public and keep 6 feet of separation like the governor just mentioned. If you're showing symptoms such as fever, cough, sore throat, or shortness of breath, please do not go to work, and you should self-isolate and avoid contact with others for at least 10 days. And most importantly, like Dr. Dan Rosiniak says, please wash your hands. And you can go to the CDC website at www.cdc.gov for further information. So since Indiana first entered the fight against COVID-19, IDHS has worked closely with a variety of state partners to not only respond to this public emergency, but also plan for any additional response needs. Partners such as the Indiana State Department of Health, the Indiana State Police, Indiana National Guard, INDOT, FSSA, and many others serve vital roles in the ability to move resources, personnel, and respond to the areas hit the hardest by the pandemic. The swift nature of this health emergency has resulted in many state agencies stepping up in different ways to address important needs as they arise. For example, IDHS staff coordinated the Critical Industries website and hotline to guide businesses and employees through an unprecedented time of closures and restrictions. Now, several weeks later, the Indiana Department of Homeland Security has been and will continue to share its subject matter expertise in building code and safety to guide these businesses through a reopening process with new and unfamiliar occupancy restrictions. The Code Enforcement Section at IDHS visits businesses every day to monitor safety codes and help them remain in compliance. This includes new and existing structures, and we have an extensive field staff assigned to districts across Indiana, inspectors who are members of their local communities, and look forward to helping in any way they can to get restaurants, retail, and other businesses back on track. Many communities have local building officials or local fire marshals who can serve as an important resource as well. Communities without those resources can reach out to the Code Enforcement Section in the Indiana State Fire Marshal at IDHS to request an inspection. If you need this guidance, please contact our inspectors at codequestions@dhs.in.gov. As of yesterday, the Code Enforcement Section at IDHS had received 68 complaints regarding occupancy limits that were outlined for most of Indiana during Stage 2. Of those, only 4 businesses required additional education and guidance to come in compliance with the plan. In most cases, a local fire or code IDHS official investigated the complaints and found them to be unfounded. No enforcement or fines have been necessary in regards to occupancy issues. The Indiana State Fire Marshal continues to work with big box stores to outline their occupancy and social distancing plans and have received feedback from all that we've reached out to. We also are working with the recently formed task force in Marion County to offer any assistance or resources that may be necessary to investigate complaints. As much of Indiana enters Stage 3 today, many businesses can expand their occupancy levels. These levels will expand incrementally as the plan continues to be implemented. IDHS code enforcement inspectors can help you determine occupancy levels at 50% or 75% in a single visit. Also, these guidelines will be sent electronically in order to limit the exposure of our staff, business owners, and employees. For restaurants, we will work closely with our partners at Health to provide restaurants the information they need to meet occupancy requirements, rearrange seating, and implement proper protections for staff and customers. We've already reached out to at least a couple of different local fire departments which have had an opportunity to go out and speak directly with folks that were either in retail businesses or restaurants in order to give them some education on how that occupancy change looks, and the feedback has been fantastic. Again, please reach out to your local code officials if possible and contact DHS at codequestions@dhs.in.gov if necessary. Our inspection staff last week resumed regular inspections of open business, including childcare and ministries. I want to reiterate that our teams will be taking proper precautions and maintaining social distancing guidelines set by the CDC during all inspections. So this includes wearing a mask during inspection, maintaining 6 feet of space, and sending correspondence electronically to the business owners. With Memorial Day and the beginning of summer just ahead, we understand the urgency of business owners to open their doors. IDHS will help in that process, but we will be guided by health data as well as the back on track reopening plan outlined by the state. These restrictions are centered on one simple priority: the safety of all Hoosiers. We will continue to monitor this process and adjust if needed to ensure business owners, their customers, and the general public have the confidence that a location is safe and all precautions against COVID-19 have been taken. And finally, I would like to recognize all of our EMS personnel during this final day of National EMS Week. IDHS has been highlighting these frontline workers all week on our website and social media, and I want to congratulate them all on an incredible response during this pandemic. Thank you for your work and service to the state. Thank you.
Thank you, Steve. Luke, you want to give us an update? I'm starting to hear from folks around the country. I'm proud of that fact about our PPE marketplace. You want to give us an update on kind of deliveries and orders?
Yes, thank you, Governor. Luke Basso, Chief of Staff, IEDC. First, Indiana has received more than 14 million pieces of PPE from the private sector. In total, the state has commitments for more than 18 million pieces, which will allow us to continue to supply the marketplace. As of today, we have shipped over 20,000 bundles to Indiana businesses. In the next month, the PPE marketplace will send over 70,000 bundles to businesses throughout the state. That's over 15,000 a week. The main reason we opened the marketplace was to give Indiana businesses the opportunity to get PPE so they can reopen and continue to operate with the proper safety protocols. The last few months have not been easy for anyone, and at the IEDC, one of the highlights has been hearing from Hoosier businesses who have been able to reopen in the last few weeks. Hoosiers like Mark Coleman of Valparaiso, who is having issues finding any PPE for his business, who declared it was like Christmas morning when he got his bundle. Or Casey McGoy of MCL Cafeteria, who was one of the first to receive the marketplace to be able to supply his employees with the proper PPE. And my personal favorite, a handwritten note from Jack Bridgewater of Southern Indiana telling us thank you. No, Jack, thank you. Thank you for being one of the many great businesses in Indiana, and thank you for putting a smile on our face. Today you'll hear from Mike Tesso, president of Liberty Trailers, a successful small business in Fillmore, Indiana, who received a shipment from the marketplace. Mike is a native Hoosier who spent the better part of the last 2 years in Poland. While Mike enjoyed Europe, he wanted to come back and live the American dream and own his own company. Mike became president on February 7th of this year. He took over a thriving small business, but due to COVID, went through a slowdown of operations. You'll hear from Mike that with proper PPE and additional safety protocols, Mike and his team are back to full strength, and he's even hired additional staff. Mike, thanks for joining us today. I know you usually come back for Carb Day, so a little bit of a different setup this time around.
Absolutely it is. Thanks for having me.
Mike, can you tell us a little bit about Liberty Trailers and what you guys do?
Sure. Liberty's a manufacturer of commercial-grade open trailers. We're located about 40 miles west of Indianapolis in Fillmore, Indiana, as you stated. And we design and produce a variety of trailers, such as utility trailers, dump trailers, tilt trailers, equipment and car haulers, and flatbed trailers that haul large equipment. We sell our trailers through a network of dealers in the United States and Canada. And since the company began in 1998, Liberty's placed a great deal of emphasis on quality. With that said, the byproduct of that has been very few warranty claims, and Liberty has a reputation for producing superior products within the trailer industry. And we plan to ensure that that's our focal point as we plan to scale and grow Liberty Trailers.
Mike, can you tell us a little bit about your experience in buying PPE and how you heard about the marketplace?
Yes, absolutely. So in the beginning, I noticed that this was a virus that was something different than we had ever seen before. And as it moved rapidly throughout the globe, I knew it was important to get supplies in-house immediately to keep our employees safe. So we were early on in relying on our existing supply base to acquire those sanitation supplies. However, they quickly began to run out as that inventory was limited from our suppliers. So a friend of mine messaged me and told me about the Back on Track program and about the ability to obtain the needed supplies that we were looking for. I searched over and over again online, even in different countries, and I couldn't find anything. So I went on there and we got that order very quickly within a couple of days.
Mike, and we'll let you get back to it here shortly, but you're a small business owner that this is affected. What's your forecast for your business through the rest of the year, and how do you feel about the economy rebounding?
Yeah, I've been fairly cautious going into this. However, we've seen a pickup of orders. So our orders are booked out all the way through into the summer, which is a great thing. And we're looking in the next few months to first and foremost keep the employees safe. In our manufacturing plant, we're well spread out. However, my initial concern was someone contracting the virus. We're dealing with various materials, most of that being steel, to build our trailers. And so it's important that we continue to use our sanitation zones that we have set up throughout the facility. And I'm happy to say that we're back to full production. And before COVID-19, we were at about 30 employees. And as of today, we have a total of 36 employees. Earlier this year, we expanded our facility. We added additional 10,000 square feet for improved production throughput. So during quarter 3, quarter 4, we are going to make capital investments into new equipment, such as a secondary powder station and oven, which will give us the ability to increase or double our throughput of trailers that we build. We're also going to install various pieces of equipment that will help us to insource versus outsource some of the components that we use on our trailers. And we're also talking with Purdue about participating in their manufacturing extension partnership, which is a wonderful program for Indiana businesses so that we can begin to integrate lean manufacturing into our facility and build a culture of continuous improvement as we get ready. So we should be well positioned to aggressively grow as we enter 2021.
Thanks, Mike.
Thank you.
Thank you, Mike. Amazing, inspirational story to start a business on February 7th of 2020 in manufacturing in America, or anywhere in the world for that matter. Could have been in Poland, but here in Indiana, and to have more employees on May 22nd, 2020 with everything that has occurred, and to be a safe working environment. Thank you, Mike, for showing the way and leading by example. Fred, you've got over at the Department of Workforce Development, you've got some sobering updates, and really your updates kind of remind us of not just the urgency, but the fact that we have to remain vigilant as we continue to reopen safely and go back to work.
So I want to share some of the initial claims result over the last week, and also the unemployment rate for the month of April. So for the week ending May 16th, we saw 30,311 initial unemployment claims filed. This continues the downward trend from our peak back in March. We paid over 1.3 million unemployment insurance payments since March, totaling about $1.7 billion. That's about $500 million in state funds and about $1.2 billion in federal funds. On our monthly unemployment report, as you may recall, for the month of March, Indiana stood at 3.2% for an unemployment rate. For April, that unemployment rate is 16.9%, while the U.S. stands at 14.7%. This is the highest rate that we've seen in Indiana since 1982, where it stood at 12.6%. So our total private employment is down by 380,000 jobs over the month. So now our private employment stands at 2,334,900. Leisure and hospitality and the manufacturing industries show the largest swing, with a combined loss of about 194,000 jobs. So I'm glad to hear that companies like Liberty are really on the rise, and they are making sure that Hoosiers stay at work and that we're producing good products. So with regard to our call center, we continue to work on the progress to make sure that we are providing good services to Hoosiers. We're still working with our high call volume. We've had about 2 million call interactions since the month of since April, and nearly 530,000 in May so far. Our average wait time has been reduced by 65% over the past 4 weeks. This is a result of additional staffing and technology changes. For our claims, we continue to see the high volume of claims. Even though the initial claims are dropping week to week, we continue to work on our claims processing. As a reminder, the vast majority of claims, about 80 to 85% in any given week, go directly from application to first payment within approximately 21 days following state and federal mandates. Many of those are paid on 14 or 15 days. The remainder, that requires additional investigation. Last week, I discussed some of those reasons why those claims may go beyond 21 days for investigation. Those things centered around deductible income, employment status, and voluntary quit issues. So today, I'd like to describe at least 2 more additional reasons claims may go beyond 21 days in investigating. One is clerical errors. During the initial application process, input errors can be made. Those errors can be made in any number of ways, by an employer, by a claimant. And when those things happen, they cause delays. We have implemented some technology that will assist us in this matter, that will help us resolve those claims faster. Another issue that requires additional investigations where the claim could go beyond 21 days is appeals. Not all claims are initially approved. Those that receive an initial denial have the right to appeal. Those that are appealed are sent to our adjudication team for further investigation. This could end up being a number of days. So although we're processing an extreme number of claims from intake to payment, we're doing it at a high rate, more than 80%, 85% within 21 days. There are still those that go beyond the period of 21 days. With automation, technology, and added staff, we'll continue to work on processing benefits payments to ensure that every Hoosier who's eligible for payment will receive their benefits. On the job availability and the public information front, as a reminder, our agency is responsible for ensuring that we connect individuals to resources and connecting employers to skilled workers. So we'll continue to have our virtual job fairs on an ongoing basis, and we have several other ones that we will have here coming up in the near future statewide. We recently had one with the Census Bureau. There was a great turnout in terms of virtual participation, and we're looking forward to more. Thank you, Governor.
Thank you, Fred. Rachel, before we get to the questions, earlier this week, I heard about this Hoosier sensation, Abby Bannon, who is a Crawfordsville High School graduate, and she's a senior, obviously, and she's on her way to college later this year. Some of you may have seen Abby's video singing and expressing her school spirit, and truly it was Abby sharing her gift, I think, and it connected not just with me, but it connected obviously directly with any, not just Crawfordsville High School graduate or student, but any graduating senior around the world. And I wasn't surprised after talking to her or listening to her for about 2 or 3 minutes. She not only is the senior class president. Not only does she lead her church choir, she's also a writer of music and is getting paid for it at this very early juncture in her life. And I asked her how long it took her to write this song that's literally going around the world. And she said, oh, not long, a couple hours. I just went online with a friend of mine and, picked up the guitar and started strumming away, and voila, there she has it. So, Abby, here's to you. We'll be watching you. I think America is going to hear a lot more about Abby Bannon if Abby chooses for America to hear about her. But we're going to play just a couple minutes or a couple seconds, I guess, of her song. And it truly is a soothing creation. And then I'm betting a lot of people Google Abby Bannon to listen to the whole song.
Remember on that first day, walking through the hallway, talking about how we couldn't wait to get to leave this place and graduate. Well, now we're in our last year, yeah, we should be there, surrounded by our friends, making memories. That's how it should be. Yeah, I wish that we could go back time, but we will have to leave it all behind. Well, here's to the ones who won't get the chance to take the field at their last home game, or ask that girl to prom, sing their school's fight song. And here's to the ones who have to say goodbye to the past 4 years of their lives that made them who they are. Here's to you.
No, here's to you, Abby. You make us Hoosier proud. With that, we'll go right to the Q&A.
Tom Davies, The Associated Press.
Good afternoon, Tom.
Hello, Governor. You put out today about making budget reductions to the state because of the downturn in the economy. How do you contemplate making those reductions without having to make cuts to K through 12 and higher education funding in the coming year? And how do you plan on making those? Are you going to involve the legislature in those decisions?
Well, one day at a time. This, of course, just pertains to state agencies, and we've requested every state agency to look at trying to trim their budgets by 15%. Obviously, we're not going to do anything that's counterproductive in terms of our COVID-19 response, but you want to comment a little further or elaborate on not just the communication that we extended yesterday,
Sure.
but how we're approaching this agency by agency by agency.
Absolutely. Chris Johnston with the Office of Management and Budget. As the governor mentioned, this is really the first step in a series of actions that we'll be contemplating over the near term. We spoke before how there was already an initiative of cost savings to start right away, and I think we put that out towards the end of April. And so those cost savings measures have been started, and those will continue on through the rest of the biennium and then probably continue on for the following biennium. But in this first step, the directive, as the governor mentioned, was specifically to state agencies for their fiscal year 21 appropriations. We will be looking, this is, again, everything is on the table, I believe, and we'll be looking at the higher ed and K through 12. But as a point of reference, when you separate that out and you apply this just to the state agencies, the higher ed, K through 12, is over 50% of the state budget. And so you look at this pool, we're really looking at about the remainder of 40% of the general fund budget. And so that 15% applies to the 40% of that budget. I guess I would say this is, as I mentioned, this is an evolving process. And there are going to be different steps that we take over time as we learn more about the revenue picture, the extent of federal assistance, as well as any flexibility to the existing assistance that we've already received. And so I think in the whole picture, it's going to be a combination of spending cuts. It's going to be a combination, including using our reserves, and then also using the federal assistance to get to the other side of this. And really the things that we're doing in for fiscal year 21 will set the plate or set the table for setting the next budget, which will be taken up by the General Assembly in January.
Thank you, Chris.
Angelica Robinson, Wayne TV.
Yep. Good afternoon, Angelica.
Hi, Governor Holcomb.
Hello.
I have some questions regarding the new guidelines issued by the CDC for reopening schools. Now, there is some concern about how some of these guidelines would realistically be implemented, especially social distancing. But my question is, how will those guidelines impact the decisions that you guys make for our schools statewide? And when can administrators expect to learn the next steps as they plan for the fall?
Well, we're working on a daily basis, Angelica, with the Department of Education, and obviously the bottom line is when we reopen with everything, we want to have it a safe environment to reopen. This is one of the most difficult decisions because of things we've talked about previously: transportation, nutrition, meal service, instruction, different size classrooms, rural or urban, suburban, physical ramifications or abilities, different schools. So we plan to have an update obviously before the next stage, but it is a close collaboration that is being, to your point, Angelica, is being, we are contemplating what superintendents, what principals, teachers, we hear from a lot of stakeholders on this, who all share the same goal of getting back to instruction, but doing it safely.
Kayla Sullivan, WXIN.
Good afternoon, Kayla.
Good afternoon, Governor. I have two questions. My first question, the Health and Hospital Corporation Board in Indianapolis has voted to hire an outside auditor to determine the level of care and COVID-19 response in nursing homes it owns. Will you call for all other public hospital corporations that own nursing homes to audit performances of their facilities? And then my second question is just kind of a clarification. With President Donald Trump ordering churches essential, we want a clarification on whether there's a limit right now for how many people can attend church in person in Indiana, and are they free to welcome as many guests as they want to at this point?
Dan, you want to take the first one first?
Dr. Dan Rosiniak, the Chief Medical Officer for the Family Social Service Administration. So we heard about that as well, probably similar to you, in the news that came out, I think it was yesterday, in looking at their board. I don't think, at least from our standpoint, there's plans at this point on ordering. I think what they're doing and looking at their particular facilities is something that we would certainly support. I think for us and for our agency, we're doing similar and trying to take our own data and trying to look a little bit more as we move forward and go into long-term care facilities, at trying to understand specifically how does an outbreak occur, how does it spread, and what lessons can we learn that we share with other facilities. We've been doing that the whole time with our guidance, but like I think all other state that are involved in long-term care, we're interested in looking further and trying to see what we can do to continue to decrease spread.
Thank you, Dr. Dan. And Kayla, and I see Joe kind of making his way up, but I would just say in regards to the President's comments, our churches, as you allude to, have already been open to those who are worshiping, and we've trusted our faith leaders to make sure that those who are worshiping are properly physically distanced, that the sanitation levels are accommodating those healthy and safe environments. And Joe, you want to talk about what's posted on our Back on Track plan specifically for churches?
Yes, Joe Herons, General Counsel for the Governor's Office. The guidance, actually the executive order that we just issued yesterday when it comes to religious services and places of worship, it's unchanged from the previous version. And as the Governor mentioned, currently there is no limit on the number that can attend a religious service, but they have to engage in social distancing and what have you. We do have guidance, specific guidance that was issued for the last executive order. It's continued for this one because there's no changes on the Back on Track website that you can find and go through, and it outlines a number of suggestions and recommendations, including that to the extent possible, virtual services are still preferred and encouraged, because we are still in a situation where when you gather people, there's a risk for transmission, especially for those older than 65. And so again, the Back on Track has great guidance, and I would encourage people to go there for further information about religious services.
Thank you, Joe.
Jody Kaufman, WRBI.
Good afternoon, Jody.
Good afternoon, Governor. I have to say before I ask my question, I love that every day you have a Southern Indiana Madison Regatta mug sitting next. Governors do appreciate that and notice, so thank you.
Well, I'm proud.
I believe my question today is for Dr. Box. Okay. So for months now, you've told us that the most accurate and best test for COVID-19 is the nasopharyngeal swab that goes all the way into your cavity. But it's reported by several people in our area that are getting the test that they're now using the short nasal swabs, that's what Optum is using to test. So is it possible that those people could be getting false negative because they aren't what you thought was the best test? And if that's not the case, could we have been using the shorter swabs this whole time?
The question is very appropriate. When we look at the anterior nares swab, which is more easily done, has less risk for causing a nosebleed or discomfort, it probably is positive if a person is positive about 60% of the time versus our nasopharyngeal, which usually we assume to be around 70%. A lot of it has to do with the way in which the swab and the specimen is taken. We are doing anterior nares swabs right now, and we'll continue doing that as we expand our Optum testing sites for children, because that's a safer test to do. We are looking to increase testing with nasopharyngeal swabs at those Optum sites, especially as we start to test, for instance, if we would test employees of long-term care facilities that are asymptomatic, that's even more important that we use a nasopharyngeal swab. So we are addressing that issue and increasing that capacity.
Ed Feigenbaum, Legislative Insight.
Good afternoon, Ed.
Good afternoon, Governor. I feel like the proverbial ninth caller here. Yeah. I want to follow up on...
Long-time listener, though, I'm trusting.
Yes, sir. Following up on Lindsay and Nikki's questions about gaming on Wednesday, we know the Indiana Gaming Commission's provided detailed reopening guidance to the 13 commercial casinos and that you're not ready yet to focus on an opening date. But in some other states, Native American casinos, which have not always been required to adhere to state laws and standards, have been first to reopen. About an hour ago, the Native American casino in South Bend tweeted that they're working on a reopening date. They've linked to a new set of safety guidelines. Question for you or Cindy Carrasco. Have you asked the Pokagon Band of Potawatomi Indians to follow the same guidelines and timelines as Indiana's 13 commercial casinos? And are or will you be asking them to abide by state and local public health guidelines going forward as part of your ongoing compact negotiations with the Pokagons?
Yeah. Happy to. Joe's making his way up here. Happy to talk with them. I have not to date. Joe, have you or Cindy or Sharon been in discussions?
Yeah, so this is an issue that we're going to have to look into and get back to you on, Ed. It is my understanding, without confirming it, that they are technically not subject to the state's restrictions in this respect. They can follow their own, but that they have been cooperative with the Gaming Commission in the past. But again, we're going to need to look into it and provide you with a more fuller answer.
Thank you, Joe.
Thank you.
Elizabeth Binion, WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon, Governor. My question is for Dr. Sullivan. Is she with you today?
She is indeed.
Dr. Sullivan, you've often mentioned that the Family and Social Services Administration has learned valuable lessons that have informed your response to the pandemic and will continue to inform your agency's approach in the future. What specific programs, policies, or procedures developed to address the public effects of the novel coronavirus do you hope to keep in place once this immediate public health emergency has passed?
This sounds like a very recent conversation we've had.
Thank you for the question, Jen Sullivan, Secretary of FSSA. Do we have a week to chat about these
You'll
things.
Be back.
Absolutely. Thank you for the question. It would take a long time to go through the entire list of things that we have learned and that we'd like to continue to do. First and foremost, I think probably one of our greatest successes has been the use of telehealth to expand services to individuals, not only for primary care, but for mental health services. I'll be talking a little bit next week on, as we receive Medicaid claims data back, on the increase in mental health use through this modality. It's been pretty extraordinary. We have definitely improvements to make in that area as we work in partnership with the Lieutenant Governor's Office on broadband initiatives to make this available to every Hoosier wherever they are. But that would, I would say, far and away be our biggest win. Second has been the expansion within the SNAP program. Our ability to do SNAP through delivery services has allowed Hoosiers who are at a higher risk group here in the next couple of weeks to receive their food via delivery at home in a safe environment, which has been incredible. But even things like being able to do virtual care for individuals with disabilities or doing virtual coaching for our First Steps program, we've learned how much more we can engage families using technology. And as one of our program supervisors said, we've gone from couching to coaching. And I think that's probably one of our incredible lessons learned on how we can be part of bringing families together and communities together, even though we may not be physically present. So more to follow on keeping these programs and lessons learned at the forefront, but we will be a very different agency on the other side, better and more accessible to the 1.5 million Hoosiers that we serve. Thank you.
Dr. Sullivan, can you just tease out next week's presentation a little bit more in terms of the telemedicine? And on what I'm referring to is when you do connect with someone who is in need, that connection time has risen as well?
Yeah, absolutely. As we look across our community mental health center network through the state, we've seen that the ability to get appointments for mental health has been really pretty incredible. So from the moment of asking for an appointment to getting that appointment has gone from sometimes several weeks down to next day. The collaboration also with the integration of the Indiana 211 network, so that when someone calls in for mental health assistance, being able to, within the family, make those direct connections to mental health care is also really heartwarming. We have so much more work to do, but the things that we've learned that we are capable of doing with integrated networks, with this expanded use of technology, is available for Hoosiers to have the help they need. And for those who are in need, starting at the BeWellIndiana.com website is a very user-friendly, integrated, really thoughtful resource to do self-assessments and also get referrals for help. Thank you.
And we don't have a week, but you mentioned that you're seeing people not miss appointments and they're making that connection.
Absolutely. The no-show rate, which is something we talk about in medicine frequently for mental health centers, in some centers is the lowest they've ever seen. So when you have a telehealth appointment, you might have fewer barriers to getting there. You don't have to take the day off of work. You don't have to find childcare. You don't have to leave your home. And so we're seeing upwards of over 90% show rates across our clinics, where often they would see 60 or 70% show rates. So really, really good work.
We'll hear more Wednesday.
Thank you.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. Question for you and a question for Dr. Box, revisiting a couple of earlier questions. As far as the budget situation, there was the question earlier about what could happen with K-12. Does the situation in terms of whether K-12 schools reopen or not in person as opposed to virtual, does that affect the ability to look for monetary savings there?
Two separate questions. Two totally separate questions.
Okay. And my question for Dr. Box, 2 days ago, you said you didn't know what was behind the spike in Elkhart, although you suggested it might just be more testing up there. In the 2 days since we saw you last, they've had their two highest totals yet. Any more on what's going on up in Elkhart County?
Yeah, their testing numbers have increased quite a bit. They have 11 sites up there that are testing actively. So when you test more, you definitely will find more positives.
Michael Puente, WBEZ Chicago.
Good afternoon, Michael.
Good afternoon, Governor. Thank you so much. Governor, with Memorial Day weekend here and beaches reopening in Northwest Indiana, are there any concerns about keeping visitors safe, and with many of those visitors coming from Chicago?
Yes. We have our Hoosier hospitality on full display, and we appreciate our neighbor to the west. And but absolutely, that's why it's critically important that all of our, regardless on what side of the border you're on, all of our businesses, whether it's where you work or play, are doing so in a very safe fashion. And that goes down to the local level. Certainly, we're a 100% partner in this effort, and we'll continue to welcome our neighbors over.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Hello, Governor. My question today is about our 16.9% unemployment. What does that really say about our state's economy, and do we have any solid signs of any recovery? Our unemployment is higher than the national average.
Fred, you want to elaborate, but I'll tell you, I mean, there are some very good signs out there, and the discussions that we're having right now about the next quarter and the quarter after that, the second half of this year. And as our businesses go back online, a lot of our manufacturing is now phasing itself back online. They did exactly what they would have done probably on their own, but what we asked, and that is to create safe working places. And so when you're a state like Indiana, who's the #1 manufacturing state per capita in America, and COVID-19 washes upon your shore, and you got to turn and do things differently and make those investments so that you're taking care of your #1 asset, your people, your workforce. They took on a lot fast, and now they're starting to turn very responsibly, and the whole supply chain that goes with that, doing the very same thing. Fortunately for the state of Indiana, we are an extremely attractive tax and regulatory environment, and so that's why we're seeing this interest as we responsibly come back online, more interest on growing business here. Fred, you want to talk about the comparison of that 16.9%? We used to be as you mentioned, we were 3.1%, the lowest unemployment in any state that we touch. That's right. And a record low, by the way, where we are right now and kind of how you project us in the next quarter.
Okay. So coming into this, Indiana did experience, some of the lowest unemployment that we've seen in quite some time. So there were a lot of things that were happening very good when we went into this, but we also see signs right now that we're coming out of this, and we have some good indicators. One is on our manufacturing side. As I mentioned earlier, manufacturing was probably one of the hardest hit industries of that, and leisure and hospitality. But we are seeing, and we're talking to employers on the manufacturing side who are ramping back up. And those employers have informed us that they are ramping back up at full strength. None of those, very few of those jobs will not come back immediately. So that's one good sign. The other good sign that we're seeing is in terms of some of our internal numbers that we're seeing on continued claims being filed. Even though it's a small percentage of time that we're looking at, we're seeing fewer claims, continuing claims being filed or requests for payments on a weekly basis. Those are internal metrics that we look at to determine whether or not we're coming out of this quicker, and how that's going to look for our jobs picture come next month, or really the month after, because of the time period. And when we look at some of our neighboring states, we are still kind of in the middle of the pack. We are extremely high at 16.9%, but we're not the highest in terms of our unemployment rate there. So just stay tuned. We do see some signs, but it's going to take some time to get out of this.
Yeah, and I would just say this underscore. I had a conversation earlier this morning with the governor of Rhode Island, and she and I were discussing the importance of the theme in this together. And in terms of our philanthropic, our private sector, our public sector, all coming together, making sure that all these new jobs that Fred just alluded to, some that'll go away and then the others that will come online, how are we training? We have some very successful programs here, Next Level Jobs, for employers and for employees, and reskilling, whether it's through a certificate or a credential. And this will play a big part in addressing what you just brought up, Whitney, in terms of those new jobs and what the requirements are. But it just is a reminder that we're all in this together, whether you're a navigator or a career coach or a guidance counselor, we all have a role here.
Blaine, WEVV.
Good afternoon, Blaine.
Blaine, you have to unmute your own microphone.
Sorry about that. Governor, can you hear me now?
We can.
Thank you. Going back to the SBA reductions that you're asking for, what does these reductions mean for Hoosiers that use the state programs? And then will there be more belt tightening in the future with the revenues being down going into the 2021 fiscal year?
Yeah, I'll let Chris take the podium here, but I'll say that's the point of all this, is that we're not cutting those essential services that Hoosiers need. And that's why we're asking our state agencies to tighten their belts, to look at any cost savings that they can possibly find, look under every cushion. And we have a hiring freeze, so we're trying to kind of practice what we preach here, lead by example, and take it one day at a time. This is an ever-evolving situation, and we're trying to take the responsible steps right now, in consideration also with the federal help that we're receiving. Thank you to our delegation, and to the revenue picture as it unfolds on a weekly basis.
Yes, Chris Johnston, OMB. That's exactly right. As part of the directive that the state budget agency put out, each agency is going to be putting together a strategic plan regarding the management of their budget. And that's going to include a prioritization of the projects and programs that they administer. And there will be a sorting out of those. We want to absolutely deliver high quality services with great customer service, but it is going to be prioritizing those initiatives that have the greatest impact to Hoosiers and making sure we deliver on that commitment.
Thank you.
Our final question is from Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon. I actually have two questions, both kind of about quarantines. The first is some other states have mentioned that they are sharing information on who has, certainly on who confirmed cases are with law enforcement, in case law enforcement, other public safety officials, in case those individuals are called to their homes. Is that something that Indiana is doing? And my other question is, does contact tracing for those who are told to stay in quarantine, are they given a letter to give to their employers, in case, to verify?
Great question, Sherry. So first of all, no, we do not release that information to law enforcement. We do instruct individuals that it's very important that they have an obligation, whether it's EMS that comes to their home or someone else, if they call a healthcare provider or they call someone for help, that they let them know that they are COVID positive or in quarantine for potentially coming down with COVID disease. As with regards to the second question, what was that again?
Contact tracing.
Oh, the contact tracing. So the contact tracing, yes, that is something that our team is prepared to do for individuals that need information to give to their employer, that we can provide them not only with information about how to isolate or how to quarantine and what that looks like, how to protect individuals around them, but specifically that letter that they could give to their employer to say that they are under isolation or under quarantine.
Yeah, and just lastly, Rachel, before we go, look forward to seeing everyone next Wednesday after your long holiday weekend. Thought about doing this on Tuesday, but as you've not just come to expect, but come to see, we have some lagging numbers that come in after the weekend. So we'll meet again on Wednesday, and maybe we'll be able to talk about the Alexander Rossi, Simon Pagenaud again this Sunday on NBC 2 to 6. Thank you. Have a safe holiday Memorial Day weekend.